first thing we need to do is to try and work out the cause. What's it coming from? And if we know the cause, then we can often treat the cause. So if it's too much acid in the stomach, we can give an antacid. Then the patient themselves may have resources that they can use to help themselves. We have information leaflets that we're preparing for this year against pain, which will be on the EFIC website, for example. There are many other resources which we will flag up on the website so people can read about the subject, read about the problem, and learn how they can help themselves. Here's an example of why it can be so different from the other types of pain that we see, because the only medications which have a real part to play in most visceral pain are the morphine-like drugs, which we call opioids. We have the weak opioids like codeine and dihydrocodeine, which are often used for people with visceral pain, sometimes tramadol. But then some patients who have chronic visceral pain or who have severe acute visceral pain, we will use morphine-like drugs. So if someone goes into hospital with a heart attack, they're very likely to get morphine in some form or other. Now, morphine itself is great in acute pain, acute visceral pain, and it can be very helpful. In the chronic situation, problems can arise with its ongoing use, so it's a two-edged sword that it might help some people, but we have to take a very careful decision as to whether to use it or not. Well, that's a good point. Many doctors can and do prescribe opioids, but often this is done with the cooperation and help of a pain specialist who EFIC represent, all the pain specialists in Europe. There are also other things that we can do. We can assess pain in the pain clinic. We have a great experience of understanding about visceral pain, and we can offer interventions, blocks, which might help us make the diagnosis, diagnostic blocks, or even therapeutic blocks, blocking the celiac plexus, which conducts visceral pain from the stomach and from the gut. And these things are special techniques which only pain specialists do, which can help people. And finally, we have the pain management program type of approach, which helps people to cope with chronic pain, which is applicable to visceral pain as much as all the other sorts of pain that we pain clinicians see.